The federal government is sending $50 billion to the 50 states to improve rural health care. Rural communities are less likely to have access to emergency and specialty care compared to urban communities. The $50 billion comes as Medicaid cuts amplify rural health challenges. Center for Medicare and Medicaid Services Administrator Dr. Mehmet Oz says that states understand their own needs best.
It's designed to allow you to right-size the system, to push and catalyze needed change, to empower governors and other state leaders to do the things they probably wanted to do anyway, but now they have the money to do it.
Dr. Oz says that he anticipates states will use some of the money to update their technology and information systems. Of that $50 billion, the Trump administration says that more than $220 million is expected to come to Kansas rural hospitals. Both sides of the political aisle touting the benefit of that money. Governor Laura Kelly saying that the funding will go a long way in changing the health care delivery systems for rural communities across the state. Senator Jerry Moran also applauding the move for hospitals, saying that he worked with his colleagues to establish this fund, and now resources will be tailored to meet the individual needs of rural health care in each state. The state says these funds will go toward expansion of primary and secondary prevention programs, access to primary care, and every point on your screen that you're seeing right now.